This is John Leonard from Weill Cornell Medical College and New York Presbyterian Hospital in New York. I am here today to provide you with some updates from the American Society of Hematology meeting and data presented from the 2016 meeting that was held in December 2016 in San Diego. This section of our program is going to focus on diffuse large B-cell lymphoma. And by way of background, it's important for diffuse large B-cell lymphoma patients to recognize that there are numerous lymphoma subtypes, nearly 100 different lymphoma subtypes. Diffuse large B-cell lymphoma is the most common lymphoma subtype. It accounts for about 30% of patients with lymphoma in general, and DLBCL is treated generally with curative intent, meaning that the majority, though unfortunately not all patients, are cured with a combination of chemotherapy and antibody-based treatment. And so generally across the world, the vast majority of patients with diffuse large B-cell lymphoma are treated with a regimen of chemoimmunotherapy called R-CHOP. And CHOP stands for 4 chemotherapy drugs, essentially. The R is rituximab, an anti-CD20 monoclonal antibody. CD20 is a protein that is on the surface of B-cell lymphomas, and by targeting that protein with an antibody, in this case rituximab, we can activate the immune system to fight the lymphoma and flick switches on the lymphoma. So I'd like to focus on primarily 3 aspects of diffuse large B-cell lymphoma in the next couple of minutes, 3 main studies to mention. The first is a large phase 3 national randomized trial that compared R-CHOP, that standard therapy I just referenced, to a more complex version of R-CHOP called R-EPOCH. And R-EPOCH differs from R-CHOP in that it is given 4 days, generally in the hospital, each cycle. These cycles are every 3 weeks, usually for 6 treatments. R-EPOCH is given over 4 days, whereas R-CHOP is given over 1 day, so it's a more complicated, longer infusion. It is also what we call dose adjusted, meaning the doses of the drugs are adjusted with each cycle, and it adds an extra drug, the etoposide. So this was a randomized trial of the standard R-CHOP versus dose-adjusted R-EPOCH conducted in the United States, a large trial funded by the National Cancer Institute and the Alliance for Clinical Trials in Oncology to ask the question, does this more complicated version of R-CHOP, namely R-EPOCH, work better? Is it worthwhile to do this regimen? And the net of this large study is that the outcomes with regard to efficacy across all patients that were treated with diffuse large B-cell lymphoma was the same, meaning as of today, the vast majority of patients, as far as we can tell, as far as we know, should still be treated with R-CHOP treatment. This more complicated dose-adjusted R-EPOCH regimen has not been shown to be better at this point. So that is, I think, important information. It's in some ways good for patients in that they know that a less complicated regimen can be highly effective. Doing it in a more complex way is not more effective. On the flip side, obviously, we want to improve outcomes, and the fact that this maneuver did not improve outcomes in this group of patients is in some ways a little bit disappointing. So there is a lot more work to be done on this study. I think we'll see updates at other meetings over time as we look at subsets of patients with different molecular characteristics that may have different outcomes. But I think this is probably one of the most important lymphoma studies presented at the meeting, certainly the most important large cell lymphoma study presented at the meeting because of its nature and the fact that it, again, was a large randomized trial. A second study that I'd like to mention looks at a new version of rituximab, and we'll come back to that in our other discussions of indolent lymphoma. This is a new version of rituximab called obinutuzumab. All these names for these antibodies are kind of an alphabet soup, but obinutuzumab is a new version of rituximab with different properties, different characteristics than rituximab that have been kind of re-engineered to try to make it work better. And the net of this study, this was a study of obinutuzumab plus CHOP versus the standard rituximab plus CHOP in diffuse large B-cell lymphoma. And the results of this study showed, again, this was a large study, over 1,000 patients, international trial, showed no difference in the outcome. So the net of this is that for patients, and this is an important, though in some ways disappointing message that we haven't improved things further beyond R-CHOP, but I think the important message for patients of these two studies is that R-CHOP continues to be the standard treatment for the vast majority of patients, although there are a number of different clinical trials that are looking at these regimens with new drugs added in that will over time potentially improve things further. Finally, I just want to mention that patients with aggressive lymphomas are very interested in a type of treatment called CAR T-cell treatment. These are immune-based T cells that are immune cells that are removed from patients, engineered in the laboratory to fight the lymphoma through some complicated ways, and then re-injected into the patients. This is a very hot area. It's something that many academic centers are doing. Various companies are pursuing this. It's getting a lot of attention in the press. And I would say for diffuse large B-cell lymphoma and most other lymphomas at this point in time, this remains something that is not yet proven to be of clear value, though some patients have benefited. And I would urge patients, particularly with relapsed aggressive lymphoma, to seek out clinical trials, including data that are emerging month by month with these CAR T-cell approaches to see if this may be of value, as well as other new treatments in development. So with that, a brief summary of what's new in diffuse large B-cell lymphoma from the American Society of Hematology meeting 2016. Thank you very much. Again, my name is John Leonard.